Given autoimmune encephalitis' growing prevalence and incidence, with the number of diagnoses becoming comparable to infectious causes of encephalitis, clinicians should become familiar with its symptomatology and presentation for earlier diagnosis. We report a case of LGI-1 encephalitis in a 66-year-old male characterized by episodic memory impairment, faciobrachial dystonic seizures, and emotional instability. This gentleman arrived at the ED for seizure-like episodes involving staring, hyperventilating, shaking limbs, and continually rubbing his right thumb against his index finger. IV Keppra 500 mg was initiated to address his seizures. His BNP and his CBC were all within normal limits. A CT of his head revealed no acute findings, and an EEG demonstrated multiple episodes of complex behavior with theta-delta slowing. Despite being transitioned to 1,500 mg of Keppra BID, he still experienced multiple seizures and required intubation. While this patient remained on the ventilator, he developed resistant hyponatremia and remained comatose. He was started on IV methylprednisone 250 mg q6 hours for suspected autoimmune disorder while continuing his Keppra dose, after which he became responsive and showed steady improvement. At this point, blood samples returned positive for anti-LGI-1 antibody. After many weeks of failing treatment, this patient finally had a diagnosis and was transferred to another hospital so that he could receive targeted therapy. This case study was performed to emphasize the importance of early recognition of autoimmune encephalitis and to pinpoint symptomatology that can lead to the diagnosis. LGI-1 subtype that was specific to this patient has an incidence of 0.7 cases per 100,000 individuals, and it affects the hippocampus and the amygdala. It is rarely associated with malignancy, and it responds well to immunotherapy. Early detection of this disease is imperative. The most identifiable symptoms are episodic memory impairment, emotional instability, lack of emotional suppression, sleep disorders, hyponatremia, and faciobrachial dystonic seizures, which are described as contractions of one side of the face with flexion of the shoulder, arm, and wrist, and ipsilateral finger extension that lasts for less than 3 seconds and occurs several times throughout the day. MRI of the brain has been shown to mainly involve the medial temporal lobe and the hippocampus, which can be seen as T2-weighted flare in the medial temporal lobe and is seen in up to 70% of diagnoses of anti-LGI-1 limbic encephalitis. Treatment for autoimmune encephalitis consists of steroids, immunoglobulins, plasmapheresis, and rituximab. Most importantly, the faster the diagnosis and treatment, the higher the probability of positive outcomes of this disease.